Hello guys, welcome back to my channel Miss Artsy Medico, and let me introduce myself first. I'm Satvika, second year MBBS student, and from today I'm going to start the exam preparation series, and today I have taken the topic hematopoiesis and the red blood cell disorders. So I have taken the subtopic called megaloblastic anemia. So what is the megaloblastic anemia? So in the megaloblastic anemia we could see the macrocytic blood picture, megaloblastic marrow erythropoiesis, and it is caused due to the nutritional deficiency of B12 and the folate, deficiency of intrinsic factor also. What are the megaloblasts? These are the macrocytes and abnormal hematopoietic precursors. They are formed due to decreased DNA synthesis and cytoplasm development progresses. There is a asynchronous maturation and vitamin B12 metabolism. It is like how the metabolism of vitamin B12 will takes place. Vitamin B12 is also called as the cobalamin. It is a organometallic compound. There are of two types, methylcobalamin and adenosylcobalamin. What is the source? It is from the animal protein and from cheese and milk. Absorption. So how the absorption will takes place? After ingestion, vitamin B12 get combined with the R binder complex. In the duodenum, B12 is released and B12 gets combined with the intrinsic factor and the distal ileum, B12 is the absorbed. This is how the B12 absorption will takes place. Then let's enter into the functions. What are the functions of the vitamin B12? Cell metabolism, normal hematopoiesis, and integrity of the nervous system. So, homocysteine getting converted into the methionine by the methyl B12. And if the reaction is impaired, there will be decrease in the DNA synthesis. And propionyl coenzyme A also getting converted into succinyl coenzyme A by the adenosyl B12. And impaired reaction leads to the increased fatty acid synthesis. And this will affect the neuronal lipids, which will result in the neuronal complications. Then let's enter into the folate metabolism. So, folate is a B9 vitamin. It is a water soluble B complex and stores fresh green leaf vegetables, and absorption will be taking place in the duodenum and the jejunum. So, then let's enter into the how the functions of the folate. Folate cellular metabolism acts as a coenzyme for thymidylate synthase reaction. In the thymidylate synthase reaction, DUMP is getting converted into DTMP, and in the methylation of homocysteine to methionine. What is the etiology? Vitamin D, B12 deficiency, folate deficiency, and the other causes. Vitamin B12 deficiency is due to pernicious anemia, true vegetarians, gastrectomy, small intestine lesions. Folate is due to poor intake, malabsorption, and chronic alcoholism. So, clinical features are anemia, glossitis, and neurological manifestations. And signs like numbness, poor finger coordination, and decreased reflexes is seen. So, then what are the laboratory findings? In the general laboratory findings, we'll see the blood picture and RBC indices. The RBC. Macrocytosis is seen and blood smear showing the anisocytosis, poikilocytosis, microvalocytes, and basophilic stippling. As in the picture, you could see the basophilic stippling, and MCV increased greater than 120 femtoliters, and MCH also increased greater than 50 picograms, and normal or decreased MCHC is seen. When it comes to leukocytes, the WBC, so we could see the hypersegmented neutrophils over there, and we could see the macros, basophilic stippling, Howell Jolly body, and Cabot string, and macrocytosis. And then let's enter into the how the blood smear in the marrow. In the marrow, showing the myeloid cells and megaloblast, and in the end, we could see the difference between the normal and megaloblastic anemia.